very soft still. Look at your eyeballs. Eyes are good. She's not squinting or anything like that?
No.
Good. Nice and clear. Nostrils are nice and clear, nice and pink, which is what you should see. There's no discharge out of her nose, which is good. No trouble eating her food, right? Not seeing anything there?
No.
Good.
Okay, let me see if I can get you a little bit more in here, ma'am.
Yeah, give me yeah,
Right.
she is. Yeah.
Oh, nope, she's
Let me
not
look at
having
your
it.
mouth.
Wiggle,
Look at
wiggle.
your teethers. Let me look in here.
Wiggle.
Nice and clear. I don't see any bad. In there. Good. Let me just get something and get something here.
Exactly.
Or look at your mouth a little better.
Oh, cow baby.
Yes, you are being very brave, sweetheart. Very brave. No, I know. You just want to go everywhere, but I do need you to kind of stay still. Oh, we got a little poop.
Yeah, they look normal. That's what it should look like, Color looks good. Size looks good. I'm just looking inside real quick in there. I don't see anything in the back. You never listen. I don't see anything in the back of her mouth. But look, she's holding it.
You think that's
She's
nice?
good.
Did you think that tasted good? It doesn't.
Let her sit down there for a second there. That's it away you. Let her just walk around for a second. Let's see what she does. Her color's nice and pink of her toes. She's very curious about things there. And you don't, just an important question, if you go back to last year at the end of the winter, a year ago, do you remember her showing any episodes like this before?
No.
Good, never had any, okay, good. And she's never had, I remember, any respiratory infections, anything like that in the past? Nothing like that, good.
No.
Never any allergic responses to anything like that? Good.
No.
I know. You sound good. So if I don't hear anything bad going on, hang on.
Oh no, sorry, you're gonna get angry with me soon enough, I'm sure.
Yeah. We're curious about things.
It's okay.
I don't hear any fluid in there, which is good.
It's okay, babe. God, listen.
When their heart rate's fast, they beat 250 to 350 beats a minute, pretty much.
Yeah, that's what happened. That's what
They're racing,
Okay.
She's only about 200. She's not even that bad.
Is that just like nervousness or?
Yeah.
Just, okay.
And they normally, the small, horses have a heartbeat of about 10.
Right. So
Whereas
small,
parakeets are about 400, lovebirds are about
Oh,
500.
wow.
Cats are 100, dogs are 75, 65. But there's variability in people too. I don't hear any fluid in there. Let me get to your throat. I'm trying to listen to your throat. I know.
I know,
There's a slight wheeze in the throat. I'm trying to convince myself, but that's pretty minimal. Wheezing could be anything. Get your poop off there, you. Get your poop off there. Thank you. She's like Mickey Mouse ears.
I know,
She's in
yeah,
darkness,
they're
so
really
they're
big.
pink.
Very good, sweetheart. Good job. Oh, I know, you just want to run. She's like, I just.
So weight-wise to her, number matters, but when I do feel her, I think she feels okay. She doesn't feel thin. Do I think she feels thinner than last time? Yeah, I do think she does, but that's not unusual. The weight can change. If she's not as active, she's hiding more and things like that, When I feel her belly or I feel her bladder in there.
But they say when the animals hide, like something going on.
Right, sure. That does mean, it usually means something's going on, but it doesn't always mean it's bad. It just, for example, if they're more angry, they're threatened by the other ones for other reasons. Let's feel for a second.
What about her vision? Does her vision seem okay?
You can't tell vision. I mean, I can see her eyes; they look normal, but you can't really tell anything in terms of vision-wise.
Right.
That. Let me just look here for a second.
Because
Toes look normal. Toes look normal.
about the light.
Nice and clean. There's another tooth coming out. I know. Has her hair been thinning?
Yes, yeah.
Yeah.
Yeah, those are the two spots.
Yeah.
But
But
it thins
do you
and then
see
it
her
comes
breathing?
back.
Do you think it's getting worse, the thinning?
Do you
No, it's
see
about
her
the
breathing?
same. Like I said, it comes back in sometime. We think it's because of the way she, the little tight spaces she rubs up against.
Yeah, we talked about that before. Yeah. Yeah, I mean, I told you before that it's possible that could be that. Possible, I mean, it's not as common in these guys. In guinea pigs, for example, we see it a lot where they get hormonal alopecia or hair loss.
Right.
Alopecia, you know the word alopecia. I don't know, did I tell you this last time? I don't know if I told you. So alopecia is hair loss.
Right.
It's obviously not dermatitis because it's not red or irritated, right?
Right.
Dermatitis is when the skin is red and irritated, like you're itching,
Right.
you're scaly, scabby, all that stuff. This is just the hair is thinning. She's not pulling it out. It just grow back in, right? You can see it come back in, but then it thins back out again. So there is truth that rodents, and it's a well-known fact that rodents, when they're not spayed, because we don't spay, you know, we do rabbits, we do some guinea pigs, but we don't hamsters, gerbils, rats. Most people don't spay or neuter them because it's pretty invasive. It's much more risky with them than a bigger animal, and they tend to chew up in their stitches and things like that. And I'm being mean now, but when you have an animal that lives 2 years in life, does it really help them? Yes, it prevents more cancers, ovarian cancer, uterine cancer, but it's not like they live 10 years or 15 years. So a dog that lives 15 years, a cat that lives 18 years, has real bang for the buck of having surgery, right? You know, it's kind of hard to take a 1-year-old, if it's only going to live 1 more year anyway, and take the risk, because it's significant fluid in there. I don't hear evidence of heart failure, at least I don't hear it. It doesn't mean it's not there, but I don't hear anything going on there. The dilemma is, if it was the same or better, I would say go home and do nothing. I think you got to decide if you want to do anything or not. If you want to do anything, the standard answer would be take an X-ray. That's usually the best way to see what's inside there. We take one view this way, one view this way. I'll get your price in a second. But that's the only way really to look inside. Second option is, do we put us on medicine? Again, I don't like to give willy-nilly antibiotics because it doesn't. You're not coughing, you're not sneezing, you're not wheezing. We've held this for 10 minutes. I've heard not one noise out of us. When you have pneumonia, when you have bronchitis, when you have trouble breathing, it's very evident. You know what I mean, like that. You're not hearing any of that. Lasix, I don't hear any evidence of fluid in there, at least right now, which is good. Gabapentin is a pain medicine and anxiety medicine, so we do sometimes give that to see if it's pain related. So if you give something like gabapentin and it gets rid of it, that usually means either pain or anxiety related. We use it more as a test, not as a treatment. Like we're just trying to see, is that the reason there, right?
That's a steroid, right?
No. Steroids. So steroids, prednisone.
Oh, prednisone.
So prednisone is the last choice. So the problem with prednisone, it makes it breathe heavier. So when you take prednisone, it's a steroid, cortisone. It makes you gain weight, drink more, eat more, pee more, and breathe heavier.
Oh, wow.
Right, so that's why you don't want to give steroids when they're breathing heavy like that. Okay. So you really want to do that. You know, there's no choice there. You got your poops away.
Yeah, she got another poopy.
I know, another poop there. Yeah.
Yeah, I know that.
Yeah, and it's up to you guys. Like I said, I mean.
Well, we know that the antibiotics can be really powerful. And we had